Thank you, Count Corla. Taoiseach, hospital waiting lists have spiralled out of control. We now have more than 900,000 people waiting for vital medical care as we speak. But Taoiseach, today I want to focus on just one of the very alarming aspects of this crisis, and that is the more than 100,000 children who today go without the treatment that they need. Taoiseach, I'm talking about children in need of a disability diagnosis, an autism assessment or access to mental health services. I'm talking about children who desperately need early intervention but yet face a 2-year wait and can't get access to therapies. I'm talking about children with scoliosis who live their days and nights in agony waiting for a life-changing procedure. Taoiseach, there shouldn't be one child or family left in such an awful situation, let alone thousands upon thousands. Yesterday we heard what the lack of capacity in our health service actually means for children. Speaking on radio, Dr. Gabrielle Colleran summed up just how dire things have become. She said, "I had another doctor write to me last week saying they have a child with neurological symptoms and the appointment they had been offered was for 2035. That's 14 years away, Taoiseach. A wait so long that the child will no longer be a child when the appointment comes round. The human toll of all of this is devastating. I personally know of parents of children who miss school regularly because of chronic pain, children so traumatised by their wait that they are on antidepressants, children and parents that see no light at the end of the tunnel. And of course, at the root of this is decades of bad Fianna Fáil and Fine Gael policy, 40 years of pushing private interests, weakening public health care, of slashing capacity in our hospitals, and of creating nightmarish working conditions for nurses and doctors. And we see this failed agenda again, Taoiseach, and the problems that have arisen with the delivery of sláinte care. In your failure, for example, to fill on a permanent basis 720 vital consultant positions, and in the fact that so many of our young nurses and midwives don't see their future here. The problem is that your government is wedded to a two-tier system that has failed people time and again, and that's why we continue to have a system that doesn't work for everyone. It certainly isn't working for those 100,000 children. Tastíon ahrú uan, tá rialtas ag taistáil a thógthaí seirbhís sláinte a oibríonn de gach duine. Tá gníomh pránaigh a taistáil chun dun in lech le linn ulmhór na báistí atá ar listí feitheamh a Taoiseach. This has to change, and we need a government that will actually build a health service that will work for everyone. Urgent action is needed to tackle the colossal number of children on waiting lists, Taoiseach. No plomossing, no hiding behind alibis of complexity. Your job is to do right by these kids. And there are things that you could start today that would make a difference. So I have two specific asks. Taoiseach, will you commit urgently to filling those 720 consultant positions on a permanent basis and targeting that investment into the areas most affecting children, like orthopaedics, ENT and neurology? And Taoiseach, will you invest to increase dramatically diagnostic capacity to the level required to get children off these waiting lists and into care?
Thank you, Deputy McDonald.
Well, a dús baile tá ahrú ar siúl, agus tá sé ag tacht, agus tá séfís sláinte gairí níos treise láinní ag lé, tá 6 míle daoine ag obair san séfís imlíne ná mar a bhí ag an am géine a norig. Is léir go bhfuil géarchaí amán, tá aithne going go léir tá going ar cách ó thaobh an pandéim, agus an méid dochar a dhéanaan vírus corónach ar chórsaí sláinte, an brú a chuir an pandéim ar chórsaí sláinte, agus sin éon fág go bhfuil na listí a bhd níos fide inis ná mar a bhí riv teacht an víris coronach. So the first thing I would say is change is happening, and change will continue to happen in relation to our health services. And Fianna Fáil has not been in government for over 10 years. This government, of which Fianna Fáil is a member, has dramatically increased health spending over the last 12 months, notwithstanding the extraordinary pressure that the pandemic has placed on our health services and has frustrated and impeded our attempts to get waiting lists down. Nonetheless, capacity has increased significantly in terms of bed capacity, in terms of ICU capacity, in terms of diagnostics, and particularly the funding of up to 25 million to GP access to diagnostics, which has resulted in up to 70,000 additional diagnostic scans taking place. And in terms of, and I take your point in relation to children, we do not want children waiting too long on any waiting list. And we had in previous eras got children way down to 3 months waiting. And it is our objective right across the board, from mental health to disabilities and to the acute issues in the various specialties, to get the time for children reduced very, very considerably. And in terms of, for example, the primary care psychological waiting list for access to psychology, €4 million has been allocated by Minister Mary Butler between September and December 2021 to reduce the waiting list. It's a targeted approach. It involves utilisation of public and private capacity and locums, Saturday clinics and so forth, to get the thousands of children that had prior to this initiative been waiting for access to primary care psychology reduced significantly. And likewise in terms of childhood assessments on the Special Needs Fund, Minister Anne Rabbitte has moved very strongly to and allocated very substantial funding to get those waiting lists reduced. Overall, the Minister is preparing an action plan in terms of waiting lists more generally. He did secure about 240 million this year, but because of COVID and the 2 lockdowns, the capacity has been reduced to get the amount of work done on that waiting list initiative that we want done. But the funding will be allocated again going into 2022. The waiting list plan will be announced shortly by the Minister in respect of tackling these very large numbers, which are unacceptable, and critically the timelines. But beyond no illusion that substantial change has occurred, and without question, targeting the significant waiting lists that have been increased significantly because of the pandemic is a key priority over the next number of weeks now that we're emerging from the pandemic and right into the early part of 2022 to get those waiting lists and waiting times down for all involved.
Thank you, Taoiseach. Deputy McDonald.
Rudí ag ahrú tá choirslánse faoi bhrú agus tá 100,000 páistí listí feitheamh seo an éireanna. They're the facts. I mean, we have 100,000 children on these waiting lists. And you say that you speak of the 1.2 billion additional money committed, but of course a third of that hasn't even been spent. I asked you specifically about those consultant posts that need to be filled on a permanent basis, and I asked you specifically about increasing diagnostic capacity. So coming in, trying to Taoiseach that there isn't a problem or that you've risen to the challenge simply doesn't tally with the facts. And by the way, this isn't a COVID overhang, because the facts tell us that in January 2020, long before we had heard of COVID on our island, there were 824,000 people on waiting lists. So this is a long-running problem, and at the heart of it is capacity. It's about staffing, it's about beds, it's about theatre space, and it's about diagnostics. So I want to challenge you again, Taoiseach, and to ask you to give the reassurance to those children and those families that the resources will be invested and that when your plan is produced, that it won't fall short again.
Thank you very much.
It will not be a question of resources in terms of getting children off waiting lists. Resources will be allocated to do that. And we will need your support, Deputy, and the support of the entire Oireachtas when it comes to public sector consultant contracts only. So, you know, it's interesting the 720 consultant vacancies has arisen in the last week. I don't think that's not disconnected from the ongoing negotiations in relation to public sector only contracts. There's no issue. We have provided substantial funding last year to recruit and recruit. 6,000 more people working in the health service this July than last July. 4,000 since January additional. The point being, yes, there's no problem in terms of resourcing this. And I would have some experience in terms of how the recruitment, and I think the HR side needs to improve dramatically, but equally, from the consultant's perspective, there's an issue there now that's on the table because of Sláinte Care. It's a key part of Sláinte Care. So let's be very clear that your support will be required, not play politics with it.
Thank you, Taoiseach.
Because there'll be all sorts of smoke screens put up, there'll be all sorts of diversions put up, there'll be one fundamental issue that'll have to be dealt with, and that will be a contract that fully aligns with the Sláinte Care principle and which relates to appointing public sector only
Thank you very much,
consultants.
Taoiseach.
And that will be actually the key issue.
We're not problematic
And
with that.
the
This side of the House
diagnostics,
supports
the
public
diagnostics,
Over time.
the money has been allocated for that and will continue to improve that.